No one would admit to having a birthday, but sincerely, thank you for coming this evening. If you please would stand at this time, I will give the invocation followed by the Pledge of Allegiance. Father, we come to you this evening to give you honor and to give you praise. We thank you for the opportunity to gather together this evening. We ask for your hand of blessing on this meeting. We ask that you would guide and direct our meeting so that it is full of wisdom and productivity and, as always, respect for one another, those who are gathered here this evening. We thank you for helping us to accomplish our work and our many goals this day. We pray this in your holy name. Amen.
Amen.
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time, we'd like to recognize Ms. Lee and Ms. Poche, who represent the federal, well, they're members of the Youth Council. So a few words. Welcome, ladies. Always great to see you.
Good evening. So my name is Casey Lee. I'm the secretary this year for the faithful Cumberland Youth Council, and I'm joined by my friend, Ms. Poche. We're both seniors. I'm a senior at Pine Forest. She's a senior at Terry Sanford. We just this past weekend attended the SYC conference, which is the State Youth Council in Goldsboro, North Carolina. We brought back a couple awards, so I just wanted to let you guys know about them. So we actually won the Most Outstanding Yearly Project, the second place scrapbook, the Most Outstanding Member, which is our second time holding this award since last year. We actually have a new representative on the SYC Executive Board in the secretary position, and one of our members was recognized for the Governor's Trailblazer Award.
So we recently hosted a military child appreciation event, and Councilmember Adams was there, and it was a really good event, a great way to give back to the military children in our community.
Thank you. Thank you, ladies. At this time, Commissioner Adams has recognition.
Good evening. If I can call Lisa O'Connor up, please. And it does give me great pleasure. This is Lisa O'Connor, who was hired as the library associate for the law library in June of 1990. Ms. O'Connor retired July 1, 2017, with 27 years of service to Cumberland County. Thank you so very much. Over the years, Ms. O'Connor helped thousands of county residents get the forms and information needed for their interactions with the court system and provided attorneys and others with up-to-date legal resources. I'd ask Judge Steele if you come up so you can get a picture with us. Since he was right here and it was the law library. This is presented to Lisa O'Connor, Cumberland County Library, in recognition of outstanding service to the citizens of Cumberland County, June 25th, 1990 to July 1st, 2017, from the Cumberland County Board of Commissioners, May 21st, 2018. Thank you.
would like to invite Mark Ingram, Chairman, and Duncan Hubbard, Vice Chairman of the Fayetteville Cumberland County Crime Stoppers Board, to come forward at this time, along with Major Joe Parrish, who will be representing the sheriff. The sheriff has another engagement this evening, and also Major Laura Downing, Sergeant Sean Streepe, and Lieutenant Gary Womble. These folks that you see in front of you this evening, we want to congratulate them. They represent our federal Cumberland County Crime Stoppers organization, and they have received the 2017 Productivity Award from the Southeastern Crime Stoppers Association for communities with a population of 300 to 400,000. As you know, Crime Stoppers pays cash rewards for anonymous information leading to an arrest. The Productivity Award is based on the total number of tips received, arrests made, charges, and cash rewards paid out for the programs in the southeastern region, which includes Delaware, Florida, Georgia, Maryland, North Carolina, Puerto Rico, South Carolina, Virginia, West Virginia, and Washington, D.C. Our Crime Stoppers. It's a community program operated by citizens who want to take an active role in fighting crime in our area. A 15-member board of directors administers the program in cooperation with the Fayetteville Police Department, the Cumberland County Sheriff's Office, Spring Lake Police Department, and the Hope Mills Police Department. Receiving the award not only reflects on the Fayetteville Cumberland County Crime Stoppers program, but our whole community. The success of the program depends on citizens like you and community support, mainly by providing anonymous tips to Crime Stoppers. The success of the program also relies heavily on law enforcement participation. Our law enforcement agencies are responsible for following up on anonymous tips submitted to Crime Stoppers. Congratulations on this award, and thank each of you for making our community a safer place to live, a safer place to work and play. Thank each of you, and God bless you.
I gotta teach him how to do that.
Maybe we should all just stand up behind us. Turn around.
How about coming around and shaking hands?
Turn around. Cues on the back row. The only person that's been
Yes, sir.
Yes, you got the hardware. Hang on to the hardware.
Always a pleasure, my friend. God bless you.
Turn around.
Agenda too long. Agenda too long.
At this time, I'd like to call on County Manager Amy Cannon to read the public policy comment section.
Yes, sir. Thank you, Mr. Chairman. The public comment period has a total time limit of 15 minutes. Each speaker will be given 3 minutes. We will ask each speaker, when you come to the lectern, please give us your name and address. Thank you.
Madam Clerk, do we have any speakers?
Chairman and Commissioners, we have a total of 5 speakers this evening.
Okay.
Our first speaker is Mr. James T. Lee, Jr.
Mr. Lee?
Our next speaker is Chief District Court Judge Robert Steele.
Okay, Judge.
My name's Robert Steele. My address 117 Dig Street. Chair, Commissioners, County staff, good evening. As is my habit now to provide you with a few figures looking backwards and then talk about an issue looking forward. This morning when we started the day, we had 721 people in the Cumberland County Jail. I wanted you to understand 7 of those people were designated as a suicide watch, which is labor intensive. As opposed to a week ago, we had 742 people in the jail. 8 were designated suicide watch. There was only 1 that carried over from last week, so that'll give you a little bit of an idea of the turnover of that labor-intensive but responsible act that's upon us as a county as we keep people in detention. For your courthouse, last month we had 59,017 citizens come through the doors of our courthouse. There were 19,526 hearings, to break them down. 429 were grand jury hearings. 2,220 were superior court hearings that were set. Your district court had 16,877 hearings that were scheduled last month. Looking backwards as well, the last week we had our first 2 folks recognized for successfully completing the CJI program. As you're aware, this is the bridge between folks that are caught in that revolving door of picked up, either out on bond, deteriorate, mental illness, substance abuse, a reoffend, or are back on a modified bond. These are folks that are persistent. The numbers are significant. 2 of them have graduated. I'm very encouraged by how they cooperated, the services that they've pursued, and where they are in their lives, and hopefully they will save us tax dollars by not coming back, at least not coming back as quick. Last and quickly, December 1, 2019, raise the age kicks in. Cumberland County, I think we've talked in the past, 14 and 15-year-olds now in juvenile court, 16 and 17-year-olds now in adult court, but will be in juvenile court. Same numbers in the breakdown of the 51,500 students in our county system of education. They commit about the same crimes. However, out of juvenile court many times, there's no alternative placement but to put kids in criminal delinquent court in the custody of DSS. These kids are labor intensive. They are wrapped with generally some deep-seated substance abuse, mental illness, household not a healthy environment. They're the most expensive kids, Brenda will tell you, we deal with in DSS. I'm simply saying as the numbers increase with 16 and 17-year-olds, we need to be looking forward as to how those 16 and 17-year-olds that now may face DSS placement, how they're going to impact overall on our system. I thank you for listening to me. It's a pleasure to address you. Thank all of you.
Always a pleasure to hear that information, Your Honor.
And next speaker is Dr. Canetta McNamara.
Good evening.
Good evening. I'm Dr. Kenneth McMahon, my address 4723 Flint Castle. I'm the chair of the Board of Health for Cumberland County this calendar year. As the Board of Health, we as the Board of Health think that to remain as a governing board is the ideal structure to improve the health of the citizens of our county. We as a board are composed of health professionals that not only have the knowledge to evaluate and direct the health of our county, but more importantly, we have the loyal commitment and love to move this county to a healthier place to live, work, and play. As a governing body, we take on the fiduciary commitment to ensure that everything that we say and do is for the good of the citizens of this county without any desire of personal gain. Reducing the Board of Health to anything less will nullify this fiduciary commitment that Board of Health members have to make to the citizens of this county. I quote Sirius Executive Consultant Marissa Levin, an author, speaker, and expert on boards. There are quite a few differences between a board of directors, i.e. governing board, and an advisory board. But the major difference lies in the fiduciary responsibilities. The level of fiduciary obligation is higher in the board of directors than an advisory board. If the advice of your board of directors steers your organization in the wrong direction, they are liable for that bad piece of advice. It is perhaps this reason why advisory board members readily offer much more information than a board of directors, because the advisory board is not held liable for their advice. Elizabeth Lane wrote in the Houston Chronicle that advisory boards advise and give recommendations, but without any responsibility or obligations. So while you may still get medical expertise with an advisory board, you will not be guaranteed the same level of commitment, unbiased advice, and even integrity as expected with a governing board bound by a fiduciary commitment. We as a governing board are not slow or uncaring as some has criticized us, but rather we carefully weigh in all of the facts because we are committed for the long haul to the term of this community, the health of this community. I admit there is work that we as a board need to do. We have begun that process. We are increasing the transparency with the health department by charging the health department leadership to timely present internal and state reports, whether they are good and bad, while we as the board are reporting our meetings to the public. We as the board welcome collaboration with the community. Thank you so much for your time.
Hey, and thank you for your commitment and your enthusiasm.
Our fourth speaker is Ms. Ethelyn Baker.
Ms. Baker.
Good evening.
Good evening.
My name is Ethelyn Holden Baker, and I reside at 810 Executive Place, 28305. Although I expressed my views during the public hearing on April 16th, I'm here again to reemphasize my desire to have the County Board of Commissioners to assume oversight of the health department. As commissioners, you are elected and have been scrutinized by us, the voters, who believe you have the desire to serve in the best interests of the people, your constituents. When we have concerns, we feel we can go directly to you, our representative, without your allowing friendship, politics, or partiality to deter you from doing what's best for us. For an example, I do not believe the health department will be in the situation it is today or when it was last year regarding the closing of the adult clinic, with not informing the cancer patients of their test results, or the closing of the dental clinic, had the board, the commissioners, been in oversight of the health department. I believe the problems the health department has faced in the past would have been resolved differently if the commissioners had oversight of the health department. In other words, I believe the Board of Commissioners can be objective in its decisions regarding the health department and the health of the citizens of this county and city. I strongly urge you to assume oversight of the health department. Thank you very much.
Thank you, Ms. Baker.
Our last speaker is Ms. Lori Brand.
Good evening.
Good evening. Hi, I'm Lori Brandt. I live at 8501 Independence Drive.
And I'm Ms. Karen Morrison. I also live on Independence Drive, and I'm here for moral support.
We're here tonight representing the people of Mount Vernon Estates Lake and Dam. We have sent you a petition asking for you to loan us the money to repair the dam destroyed by Hurricane Matthew. And we are fast approaching the deadline set by the Corps of Engineers, so we're hoping that, praying that you will see it in your hearts to grant our petition. Before the hurricane, the state of North Carolina declared our area a source of drinking water, culinary and food processing water, and irrigation. We also are part of the Cape Fear watershed. We have about 2,000 acres for that watershed, and our dam helps with the control of water for that area. We are a potential source of water for the fire department that is a couple blocks from us, and there's a lot of wildlife that depends on that lake, some of which has come back, but a lot of it is still not there yet. and we're hoping that we can get a lot of it back. We're asking that you all would approve that petition in the fast-growing area of our neck of the woods, and in an area that is of significant benefit to the watershed and the environment. We thank you.
Thank you. Thank you, ladies.
There are no further speakers.
Okay. Thank you, everyone, for coming this evening and speaking with us. We'll take everything under advisement. At this time, County Manager, any changes in the agenda?
Yes, sir. Mr. Chairman, I have two changes for the board to consider. First, per Mr. Lloyd, I think we can move item 5H. It's a rezoning case, and move that to uncontested. And then the second item, Mr. Chairman, is I would ask that the board agree to add a closed session for economic development pursuant to the North Carolina General Statutes 143, 318, 11A4.
Madam Manager, also let's clarify that there are actually 3 separate attorney-client matters.
Yes, sir, that's correct. Thank you.
Okay. With that, do I have a motion?
Move the agenda be approved.
Okay. We have a motion and a second. Any further comments, questions? If not, I'll call for your vote. That's unanimous?
Unanimous.
Thank you. Presentations, call on Manager Amy Cannon to introduce some folks.
Yes, sir. Thank you, Mr. Chairman. I'm going to call forward Ms. Sally Shutt for a presentation on the Pathways for Prosperity Comprehensive Action Plan and consideration of resolution in support of this initiative.
Good evening.
Good evening.
In May 2015, Harvard University released a study ranking Fayetteville last among the country's 100 largest economic centers in earnings potential for children growing up in poverty. Pathways for Prosperity emerged as a response to these findings. The initiative is a multi-year effort to bring together local government leaders, community-based organizations, community members to prioritize and coordinate action. So, the City of Fayetteville is the convener and partnered with the North Carolina Justice Center. And so tonight I'd like to recognize former City Councilman Kirk Deviere and City Councilman Larry Wright, who have led this. As a community partner, Cumberland County has been represented by the Board of Commissioners, and Commissioner Adams served on the core team, as well as Brenda Jackson and Vivian Tooks from our Department of Social Services, and they are here. Our Public Library Director, Jody Rishisher, and several library staff members have participated. Workforce Development and our Director, Nidra Rodriguez, and also County Management have all participated on the core leadership team. I'd like to recognize if any participants in the work groups are here, if they would also stand. So these folks have been working on this comprehensive action plan. So to introduce this and review it with you is Adam Svalto. He is the Deputy Director of Policy and Engagement with the North Carolina Justice Center. So Adam.
Adam, welcome. Thank you for coming.
Thank you, Sally. And thank you, Chairman Lancaster and Commissioners, for the opportunity to speak with you today. You'll find included in your agenda packets the full comprehensive action plan, and that document lists 10 objectives across 5 focus areas, along with strategies to achieve each of those objectives. And indeed, the plan represents a very strong team effort by a number of folks, and I'm just really happy to be part of it. I'll be covering the objectives at a high level, so that you can get an idea of where our efforts are headed, and so that you can see the ways in which the work overlaps with county interests and goals. So we'll first touch on the areas, the communities where poverty is most concentrated in the county, and these represent 8 neighborhoods, 2 municipalities, and 1 unincorporated area. And while that unincorporated area at Census Tract 29 has a poverty rate that's close to the overall county rate, some of the communities here have rates double or triple the county rate of 18%. The aggregate poverty rate across the 15 census tracts represented here is nearly 30%. And for a frame of reference, the 2018 federal poverty guideline for a family of 4 is $25,100 in annual earnings. So work groups impaneled around each of the 5 focus areas that emerged from the summit event in November met several times to produce these objectives. There's a slide for each of the focus areas, and I'll go through those. At the top, you'll see a lead agency listed. This is the entity that will be responsible for driving a given set of objectives forward. And it's important for me to share that all of these objectives attempt to address the root causes of poverty. And in so doing, they support economic development, job creation, and serve as a complement to the county's social services work. So let's start with the pre-K objectives. The lead agency here is the Partnership for Children of Cumberland County. They've been very involved since the beginning of the initiative. Given what we understand about the connection between poor attendance and the achievement gap in the K-12 system, the pre-K work group chose to work on this issue early and address it with a campaign at the preschool level. In other words, get the attendance right as early as possible, and that will impact the K-12 system. The second objective seeks to increase the number of available slots in 4- and 5-star rated centers in our 11 communities, specifically in those places characterized as child care deserts. The work group is still in the process of mapping where those deserts are, and both of these objectives aim to improve readiness and attendance in the K-12 system, as well as remove a barrier to economic participation for young parents who may have difficulty accessing quality child care. As children come into the K-12 system better prepared to learn and perform, we can build momentum by getting them excited about career paths that are emerging in the local economy, and ensure that youth who learn best in non-traditional ways have the opportunity to build skills that will lead to meaningful, in-demand work. And that's what this first objective is about. It'll require close coordination between the Workforce Development Board and the Cumberland County School System. To reduce suspension rates, we will impanel a community agency council, which will consist of community members, school board members, teachers, administrators, and students, to consider and adopt evidence-based alternatives to suspension. And I'll reference here a recent report by Duke University that listed 11 such alternatives, including restorative justice and substance abuse-focused programs. These objectives support an improved learning environment and, importantly, reduced likelihood of early contact with the justice system. Both of those will help build and support a better, more prepared workforce. Communities and schools will lead the life skills objectives that are contemplated in the action plan. And this is a case where we plan to build on a model that's already in place in the community. We're looking to replicate the Walker-Spivey Parent University model in schools that are serving children and youth in the 11 focus communities. And these are about 39 of the 87 schools in the Cumberland County system. Engaging families will provide the opportunity to offer financial literacy education, connections to job training, and parenting support, all of which support the learning environment, home environment, and create opportunities to build social capital. The second objective here seeks to build sustainability by identifying and lifting up leaders in the community. And this work will be undertaken in coordination with the K-12 and workforce development stakeholders, represent a key tactic in interrupting concentrated poverty. The housing objectives are focused on building inventory to support those residents whose earnings are at or below 50% of the area median income. And for the Fayetteville area, it's about $52,000 a year. So those making about half of that or less, and who pay more than 50% of their income in housing costs, or severely cost burdened. And that represents currently about 9,110 households. One of the ways Pathways seeks to deliver value is through tying together organizations that sometimes work in silos and to build channels between those entities in areas where resources and investment will lead to the greatest ROI. Here's where all of the other objectives come together, and for these goals, the county's Workforce Development Board is contemplated to take the lead. One of the strategies here, for example, is to increase the number of certified career pathways from 2 to 5 within 3 years. This is something the board is already working on. The initiative can support by working with the school system to get kids exposed to and excited about those pathways early. The next phase of planning will include finalizing data to support measures for the goals and establishing a funding plan for program build-out. In tandem, we will impanel neighborhood revitalization teams to set up the networks and support needed to operationalize the plan locally. A couple things to leave with you here. What's represented in the plan that you have in your agenda materials is a living document. It's going to iterate over time. We're not going to get it perfectly the first go around, and I think there's an expectation that we'll continue to add to and modify as the community learns things. The other thing I will share is that if it's successful, the plan will increase the community's attractiveness for private investment. And the collaborative nature of the initiative offers both efficiencies and an opportunity to fully leverage community assets. I'm happy to take any questions that you have.
Any questions of Adam at this time? Mr. Booth, Commissioner Booth.
Yeah, is there a scheduled, more in-depth presentation in the near future on any of this? Or when's the next time you anticipate we'll hear from you?
Well, I think a good point to return would be as we finalize a funding plan, which over the next 3 months the core leadership team is going to be working on. In other words, figuring out exactly what funding streams, whether they're foundations or federal or otherwise, that may support the program build out. But I'm happy to engage more fully if anyone wants to meet separately. More than happy to do that to further answer questions.
Okay,
if not enough time now.
Because I don't want to, I was looking up here, and I was waiting for somebody else to start the little button going, and it didn't happen. So I'm not going to, just keep you here for just me. But if you and I want to get lunch or something sometime, I'd love to hear more about this.
I'll be happy to do that, sir.
Okay, thank you. Thank you, sir.
Any other comments, questions? Adam, thank you. Thank you.
Yes, Mr. Chairman.
And thank you for your team. Councilman, I see you came in. Good to see you, always. Kurt, always a pleasure. Thank you.
I would just like to say, I think this is so important for the county and the city. And some other things that I had going on that I dropped it, because I wanted to be here to see this presentation, because the impact that this will have on our county and our city, there's no end at what we can accomplish. So thank you for listening.
Thank you. Commissioner Adams.
Mr. Chairman, I do thank you. Adam has been working on this. We've been working on this over 2 years now, going through this, and they meet every Tuesday. I don't necessarily meet all those meetings, but they send me all the information. This is one of the things in the initiatives that I brought forth about a year ago. I think they have done yeoman's work, not just them, but those that in the community. These meetings have been happening all over our community, and I will tell you that in terms of participation, there's been no greater participation than in this project throughout the community, and I think it's one that is truly important to this community, but more so to the citizens of this community. That's what we're here to do, is to push that. Again, you remember, and I've always said it, government initiates, but it's got to be the citizens and the people of this community that eventually drive this chain. Charlotte's been working on this for more than 3 or 4 years, and It's not anything that's gonna happen overnight. It's not gonna move the needle in the next day or two. So people are like, where's the needle moving? This is a long-term project, and we've all got to be invested in this. And I know that the recommendation is to consider endorsing the Pathways for Prosperity Comprehensive Action Plan by approving the resolution, and I would make that motion.
Have a motion and a second.
Yes, sir, second.
Okay. All those in favor?
Unanimous.
Unanimous. Okay. Thank you. And I would add also that it's probably one of the most comprehensive initiatives that I've been a part of. So again, thanks everyone for your involvement. At this time, anything to be removed from the consent agenda?
Not from management.
Okay. Anyone here, everything? Mr. Booth, Commissioner
Yeah.
Booth.
I'd like to remove D, E, and J5.
D, E, and J5. Okay. Any others? If that's it, all those, with the exception of D, E, and J5. call
I'd
for-
move to approve the consent agenda.
Okay, move to approve. Second. I have a motion and a second. All those in favor? Okay. that's
Unanimous.
That's unanimous. Okay. Out of business?
On the consent agenda, item 3D is approval of Cumberland County Public Health Department Billing Guide effective July 1st, 2018.
Okay. My question with that is, I like the structure, but in my reading of it, it's 20-plus pages. It says that every current patient or client is going to get a copy of it, and everybody's going to get a copy of it that comes in from this point on. I can just hear the trees in the great Northwest falling, that every time we see somebody, we give them a 22-page document. There's got to be a little bit cleaner way of doing that. I mean, I don't think anyone coming in is going to sit down and read 22 pages of the billing cycle. Then also, I think it'd just be cleaner just to say we have a comprehensive, almost comprehensive health department for our citizens. Because in every, and maybe it's just the lawyer language you have to put in this stuff because of Title 10 and everything else, but everywhere it says that they're going to have to prove verification of income, says unless they don't want to. All right, then services will be denied if they have an outstanding bill unless they insist on having the services. There's nothing definitive in it. And so my question is other than a 22-page document, there's exceptions, there's about 4 exceptions to every mandate. And so we're not going to do it for STDs. We're not going to do it for family planning. Yeah, see, there's, you don't have to prove, you don't even have to live in Cumberland County on a handful of this stuff. And if you don't live in Cumberland County, you don't have to provide ID to get there, so we're not going to even be able to check that. It says there's a list of stuff that you have to be a Cumberland County resident to get the benefit of it. But it's not required to show where you live in order to get services. It's not going to take anybody, but about 2 seconds to figure out, I live in Hope County, I'm here because ours is better, and I go up there and they go, I look at the board of stuff I can get if I live in Cumberland. I say, yeah, I live here. They go, do you have anything to prove your address? I go, not with me. They go, okay, well, have a seat over here. You're number 23. So I just didn't, it was I don't know if we just have to have a billing thing. If we do, that's fine, but there's absolutely, and if someone doesn't pay their bill, we're not going to refuse them services. And if someone doesn't pay their bill, we can't turn them over to collections. There is actually a part in there that said that if someone doesn't pay their bill and we find out that they won the lottery, we'll go after them. it's actually in there, that will seek their lottery winnings. If somebody comes into the health department after winning the lottery, that should be the proof of income thing that says they shouldn't be here, they should be going somewhere else. So, I mean, 22 pages of, sorry, Judge, legalese.
So, Commissioner Booth, I think you bring up some good questions. We do have to have a billing guide, and most of this information that's included in the billing guide is in compliance with requirements from the North Carolina Department of Public Health, the North Carolina Department of Health and Human Services, Division of Medicaid, and the Center for Medicare and Medicaid. So there's not a lot of leeway that we have in this document. I mean, we can certainly have someone from the health department.
I have no problem with us providing health services for people that need health services. It's just that, I don't know, have we ever foreclosed on someone's house because they didn't pay their medical bill? I would hope not. I hope the answer is no.
No,
but,
sir.
Okay.
The extent of our collection efforts would be the North Carolina Debt Set-Off Program, which is what the lottery winnings are, which would also include any income tax returns, certainly anything that we have at our disposal to collect.
Well, I tried to ask around, and I didn't find anybody that had actually taken that step to people who already are not in the highest tax bracket and are working but are qualified for our services, come in, are honest with us about their income, we give them the services, and then we try to garnish their tax refund. I'm glad to hear that we haven't done that, or at least I couldn't find anyone where we'd actually done that, because those folks need that tax return as about as much as they need anything else, the tax refund. So I have no problem going after the lottery winnings, but, you know, it just seems contrary to providing public health to people who need it, and then having a 22-page document talking about how we're going to bill them and go get their money.
If they are assessed a self-pay requirement, it's because they've actually gone through a ability to pay assessment. So we look at their income and their family size, and we place them on a sliding fee scale, and so it goes from a minimal amount up to a larger amount depending on their income and family size.
Okay.
Item E.
Are we going to approve that, or what we're going to do? What action are we going to take on it?
Well, I guess.
Mr. Chair?
Yes.
I have a light on.
I'm sorry. Commissioner Keith?
Thank you. I have a number of the same concerns Mr. Booth had. First of all, I want to ask the question, was this fee schedule approved by the Board of Health and then comes to us, or is it approved at all?
Yes, sir. It was reviewed and approved by the Board of Health.
Okay. And, you know, I can't help but go back, and when I became a commissioner almost 10 years ago, one of the biggest problems in our health department was teen pregnancy. We were #1 in the state, and now we seem to be making a bit of a punitive requirement here, where we're going to require proof of income required for family planning, not many of the other things, but family planning. And one of the things that we talk about so much is our youth, and how kids having kids at young ages can really affect their lives as they move forward. So there is a lot of contradictory statements here, and I'm not sure how deep the health department went in there, but it says proof of income is required, but then there'll be confidentiality as you go by. And if you don't want to receive explanation to benefit, there's just a whole lot of I don't think most people would understand it when they came in, but I do think trying to continue on with this program here will disenfranchise possibly people from government to the health department. One thing I have found out in government is that people look at their wallet when they make decisions on everything, whether it be taxes, whether it be fees, whether it be schedules. There are just too many questions on this for me tonight that I don't believe it's in the best interest of the citizens that go to the health department, and I believe may be punitive for some family planning area, and I understand the need to have it. But just a month or two ago, we reduced the fee for one service that we had based on a recommendation from the health department. So it just seems to be a lot of items in here that contradict each other. Thank you.
Commissioner Adams?
Thank you, Mr. Chair. Madam Mayor, I just got a couple of questions. I mean, we've had this. This is not anything new.
It's a billing guide that we've approved in other years. They're just some updates.
Updates?
Yes, sir.
Okay, and so, and one of the things I would have liked to have seen would have been the highlights of what the updates were as opposed to it all within the document. But the document itself is one that's required by statute and by law and by Medicaid and all of that for us to have it in there. And we've done this in the years past. Is that correct? I was just trying to get some
Yes, sir,
clarity.
that is correct. The changes are outlined on under the background material.
Okay.
There are actually 5 changes, but you're correct, they're not highlighted in the document.
Yeah, that was a difficult part that I had, but
Yes,
other
sir.
than that, but it was,
It does
just the
mention,
5 changes
reference
from
the
last time.
page numbers where the changes are.
Any other comments? Then I'll call for your vote.
Is there a motion?
Motion. We're on item
Move.
D,
What item?
approval
well,
of Cumberland.
can I ask one more question before we do it? Because I guess if there's a couple of commissioners that have some questions, does it have to be done tonight or can it be brought back? Because I think their questions need to be answered, whatever those questions are, as opposed to us, but if it's,
Yeah, yes, sir. It can be brought back.
Okay, so we're gonna move item D, approval of Cumberland County Public Health Department billing guide effective July the 1st, 2018. We're gonna pull it from the consent agenda. Is that correct? Is that all right with
So they can
everyone?
get
I
their
think,
questions
yeah, I
answered.
think we can talk about it, we'll be able to resolve it.
Okay.
Maybe we can get it down to 9 pages that we're gonna hand out, that we can actually enforce. I just don't wanna make rules for the sake of making rules.
Mr. Chair,
Commissioner Keith?
should this go to a finance or a policy to talk about it in
It's
depth?
money.
Or it doesn't matter to me, or do you want to bring it back up to the full board?
well, my thing is, if whatever commissioner's got a question, I think can do it to the interim health director or the staff. If those are answered, it could just come right back here. I don't think it needs to necessarily go to a full committee meeting. I think
But
whatever.
then the other
questions-
commissioners won't have well, maybe they don't have any.
They don't have any questions.
Okay. Commissioner Council?
Mr. Holder, are there services that we would not be able to offer our citizens if we do not approve this by July the 1st?
No, ma'am. We will continue to charge and bill in the manner that we do today.
That we've done every year? And
Yes, ma'am.
that listing of people usually comes to us? It
Yes.
comes to us?
Yes.
On our agenda?
Correct.
And we approve that list? Okay. Thank
Commissioner
you.
Evans?
Thank you, Mr. Chair. Madam Manager.
Yes, sir.
There's 5 items that are new on this particular issue, correct?
There are 5 items that have been revised.
That have been revised?
Yes, sir.
You know what, I think that if there are any questions about it, and there shouldn't be that many questions about it, I think the questions should be done tonight and dealt with instead of taking it back to any committee or bringing it back to the full board. We keep putting things off, and this is one of the places that we have been focusing on to go ahead and get taken care of. And so I think that it would be to our best interest and also to the citizens of this community to go ahead and deal with this, and let's get this behind us because we've got other issues we gotta deal with.
All right, folks, where are we? What's your pleasure?
I just think people ought to be able to have their questions. I don't think it's putting it off. I think that's just a proper way to do it. I think in terms of not being highlighted, it makes it a little bit difficult, and I think people ought to have their questions answered.
Okay.
And Mr. Adams, I do too. I believe that question should be answered, but there's only 5 items here that we're talking about.
No,
But
that's 5 updated items.
5
That may not
updated
be
items.
5 questions that any commissioner has. Somebody may have more than 5 questions. It's just 5 updated items. That's a difference.
Well, either way, I still have that mindset. I think that we should discuss it tonight and go ahead and put it behind us.
Call for a vote? Call for a vote?
What's the motion?
Commissioner Fairclough.
You want a motion or you want a vote?
Well, we got
Do
some.
we have a motion?
We got
Go
some
ahead.
dis, we got
You
some
gotta have a motion.
disagreement. Yeah, we got a, so where
You could
are we?
put the-
Commissioner Fairclough, you got the floor.
Okay. I would move, Mr. Chairman, that we table item 3D until the third Monday night in June.
Second.
Okay.
Amendment, friendly amendment.
We have
Friendly
a motion, a second, and a friendly.
and a friendly. I was going to suggest that we do it in 2 weeks,
Got enough time?
the first
I'm-
Monday in
Enough
June.
time for you?
I'm okay.
Friendly amendment accepted, 2 weeks.
And
rather
I'll
It's
than
second,
friendly.
I'll second the 2
Thank
weeks.
you. Thank you so much.
So we have a motion, we have a second. Any further discussion? If not,
Okay.
all those in favor?
Voting in favor, Commissioners Faircloth, Commissioner Keefe, Commissioner Council, Chairman Lancaster, Commissioners Booth and Adams. Voting in opposition, Commissioner Evans.
All right. Commissioner Booth, item E.
Okay. Did we get this through another committee or something other than just part of the agenda? E?
Yes, sir. This is actually a recommendation from the Juvenile Crime Prevention Council.
Okay, but did it go through a committee?
No, sir.
Okay, so except for it just being attached and in the agenda, we didn't get a preview or to get to see it until today or
No,
yesterday
sir.
or?
No,
Well,
sir.
Friday.
Actually, the agenda went out Wednesday evening. We've handled this according to our standard practice. It hasn't, in past years, not been taken to a committee. The state requires that the contracts be submitted before the 1st of June. The funding recommendations came from the JCPC Council early in May, and so we were trying to meet the state deadline of getting the state contracts to the state.
Okay. If we do this, then this is not a part of your presentation tomorrow for the rest of the county, right?
We have, we received state funding, Juvenile Crime Prevention Council funding, and it requires a county match. So yes, this is a part of the recommended budget.
Okay, and our county match is different from this year, from last year?
Yes, sir, it's a little bit different this year.
What's,
Let me get to the spreadsheet.
in case I'm missing a column, all I have is one sheet.
That's all it
The
is.
county match is
20%.
and it's $415,941, and it does exceed the 20% minimum. And most of that is related to our group home, our social services group homes.
And last year's was 383?
260.
So it's 33,000 difference?
Correct.
Okay.
And it is attributable to.
And I have one other question. This is just information. They have a new item here. It doesn't look like we have anything to do with it. Youth Max? Influence One?
Yes, sir. That was a request that was made, and then there was not follow through from the entity to make a presentation to the council, to the JCPC. So it was not recommended for funding.
Okay,
They
so
submitted an
They
application.
didn't get the request, so they didn't pass on the request. I mean,
They got the request, they didn't meet the requirements. In order to get funding from JCPC, they have to come to the Finance Committee and submit to the Finance Committee. They submitted the document but did not show up to the Finance Committee.
Correct.
And therefore was not funded. I sit on the JCPC committee and on that Finance Committee.
okay. All right.
Mr. Keefe?
Real quick, the part that I don't understand, and Ms. Cannon, maybe you can help me out. We're approving $400,000 for next year's budget before you even present us the budget.
Yes, sir, and if the board during the budget deliberations decided that you did not want to make that match, then we would go back to the state and revise go back to the JCPC council and have them revise the contracts.
But we're approving it tonight if we vote on it. So it's an approved allocation.
Yes, sir. We can certainly pull it off the agenda and not send the contracts.
I'm not asking to pull it off the agenda. I'm just, the thought processes of approving agenda items before budget items before the budget is even presented seems a little backwards.
Yes, sir, I understand that, but it's to meet the state deadline for the contracts.
If we approve it tonight, it's done. It's on the contract, it's done. Right? So, we could do it with all kinds of different departments before the budget presentation. But we don't even know what the budget says, but we're approving things on the budget.
Okay, back to you.
Yeah, Commissioner Keefe, it is out of sequence, but it's because of the way the state requires the JCPC funding to be approved, which is prior to our budget being approved. 20% of it is a match, and we don't, regardless when they send the money down, and it's actually hopefully going to go up in terms of what they tell us, especially with the underage, 16 and under. It's actually going to go up, and our match is going to be higher. I will tell you that, and I think Ms. Jackson's here, we've been working on that group home issue for more than a year and a half, 2 years, and I think we've got some kind of semblance of getting it a lot more efficient. It is really, and I agree with you, we're proving it tonight, puts it in the budget, and then it's there. But I think because of the time consequences that's dictated to us, kind of like that last item, that's where we get.
And if I may, Mr. Chair, to Commissioner Adams' point, I think JCPC does a great job. They do. They keep people, they keep them coming into court without a lot of expense going through, and I do. And I would probably vote for this in the budget. There's protocol and rules as you go through, and that's just where I had the difficulty with. As Judge Steele said earlier tonight, I think we got to expect a lot more people that possibly could be using this service, and the budgeting may be at a different level.
Well, I will tell you that we've advertised this to everybody in the community. It's been advertised on our website. We have to advertise it by pursuant to JCPC in the newspaper. We've let those who've done it in the past. So, and I understand that there may be some other needs, but I think that you're truly right that JCPC does an outstanding job. I sit on that board. Those are some hard-working folk that do that, and I think that if you want to add some more money during the budget season, they would not turn that down. But I just, you like that, huh?
I'm just focusing on that part where you said I was right.
Okay.
It's been recorded. You can play it back later tonight.
Commissioner Booth?
Yeah. All right, maybe this will help clear it up. Is this the way it's done every year? Is that they get a preview and don't have to sweat it like the rest of the departments, or is this just the 1 year that the deadline? Is the deadline different?
No, sir.
All right. Do they usually present it in February or March so we can talk about it, or is it always just done?
The allocations process begins for the JCPC Council usually in January. And their guidelines, 30 days, it has to be advertised. There's several finance committee meetings, presentations, and normally either on the first meeting in May or the second meeting, we consider the contracts to go to the state or the funding agreements. It's their funding agreements and the match. And they are required at the state by June 1st. Yes, it is out of order, but this is the process that I think we've used for the last 20-plus years to meet that deadline.
Well, anyway, we could get it in April next year instead of it needs to be done tomorrow?
We can certainly ask the JCPC Council.
You're the vice chair.
I'm the vice chair, that's right.
I mean, I'd see that if other departments were to be smart, they would make their time deadlines crunch time also, to where we don't really get to look at it real fast, and we have to have it in by tomorrow.
The manager sets those deadlines, though, for those departments, so that's a good thing. Mr. Chairman, I would move to, if there's no other questions, move to approve.
You could approve the funding agreements contingent upon the budget adoption.
Available sums.
Well, I wasn't gonna do that, Madam Mayor, but since
Well,
you did that.
there seems to be some concern about doing this out of order.
I'll second that.
That was what I was making that we approve this JCPC agreement. That's the reason.
That's the one I'm gonna second.
Thank you.
And I will second it.
All right.
So let's hear the motion again.
Move to approve the JCPC funding request.
All right, we have a second.
Second.
Okay, any other discussion? All those in favor?
Voting in favor, Commissioners Faircloth, Council Chairman Lancaster, Commissioners Booth, Adams, and Evans. Voting in opposition,
Any opposed?
Commissioner Keefe.
All right. Mr. Booth, you still got the floor, number 5. Opioid.
Well, my question, I thought this was a 2-to-1 from committee. Does that mean it goes on consent?
Yes, sir.
Was that part of the, I thought it was, okay. I didn't see that as part of the motion, but, all right, I'm not on finance, but I attended the meeting, and I think the summary's accurate. We had our attorney look into it and make a legal recommendation as board attorney to us, and he recommended the Kruger-Dickinson group. And then it went at the end of the meeting to go to the, it says here, Mr. Moorfield stated his recommendation all along has been the Kruger-Dickinson group because their approach is more in line with the county's data, and his recommendation they designate the county attorney as local counsel, meaning him. Then there was some discussion about, since we joked about he couldn't take a tip or a bonus from them by being our counsel, that the attorney's fees that ordinarily would go to some other firm or firms may come directly to the county to help us with our opioid problems. And then that got changed all the way up to a motion for the other law firm, and then that got passed. So to get the ball rolling, I would move that we approve the recommendation of our board attorney that the Kruger-Dickinson group represent us in the opioid litigation.
I'll second that.
Mr. Evans?
Thank you,
Commissioner
Mr. Attorney.
Evans, yes.
Thank you, Mr. Attorney. Kruger Dickinson? Was that?
It's another one of the groups, yes, sir.
Excuse me?
It's another one of the groups. There were always two groups of information, two groups presented to the committee.
Two groups were submitted to the committee.
Yes, sir.
And the two groups were?
Then, well,
McHugh Fuller.
yeah.
Yeah.
Shorthand was McHugh Fuller group and the Kruger-Dickinson group.
Use your microphone.
Oh, I'm sorry. Yes, sir, thank you. But for shorthand, it was the McHugh Fuller group and the Kruger-Dickinson group.
Okay, what was Attorney Gerald Beaver in this? Oh, I mean, Attorney Gerald.
Gerald Antonio is local counsel in the
Yeah, he is with them.
McHugh Fuller group.
Not one of the motion, the other.
He was local counsel in the group recommended by the Finance Committee.
Okay.
Well, so we have a motion, and have a second.
I think Mr. Keefe seconded, didn't he?
Yes.
And, Mr. Chairman, I was on the Finance Committee, and I think the Finance Committee sat down and looked at it, and the McHugh Fuller Group was the recommendation. So that would be where I would be moving to and not toward this motion.
Okay.
It was not the unanimous recommendation, but
It was not, it was a 2-to-1.
it was.
Okay. Okay. We have a motion by Commissioner Booth and a second by Mr. Keith. All those in favor of their motion, please raise your hand.
Voting in favor, Commissioners Keefe and Booth. Voting in opposition, Commissioners Faircloth, Council, Chairman Lancaster, Commissioner Adams, and Evans.
Okay. New motion?
Mr. Chairman, I would follow the Finance Committee and recommend the board select the McHugh Fuller Group.
Second.
Okay, we have a motion and a second.
And adopt the resolution. And adopt the resolution.
Commissioner
Oh,
Fairclough?
and adopt the resolution, I think is what, thank you.
Commissioner Fairclough?
I do have discussion on the motion. And I'll direct this to Amy. When we don't have a unanimous vote of the Finance Committee, do we typically put that on the consent agenda?
Yes, sir.
We do.
Yes, sir.
I was under the impression that if it was not a unanimous vote by the committee, that we would discuss it on the board. So I'm surprised.
That's why I was surprised to see it there. That's what I thought it was too.
I'm not aware.
I'm not aware of
the
any.
policy, the official policy on it.
Okay.
The minutes are always attached to, I mean, the full minutes are attached also to these.
Okay, that was just a question. That was just an inquiry.
All right, we have a motion and a second on the floor. All those in favor of the motion?
Voting in favor, Commissioners Faircloth, Council, Chairman Lancaster, Commissioners Adams and Evans. Voting in opposition, Commissioners Keefe and Booth.
Okay. Next on our items of business.
Yes, sir. Item number 4A is consideration of human services governance model. I'll ask Mr. Holder to go through this item. This was actually an item that the board discussed at your May 7th meeting. Action was taken to set May 21st, this evening, for a final decision on human service governance.
Okay.
Good evening. As was stated, this board did decide to set this evening as your deadline for making a decision on governance. Just as a reminder and a review of the 4 options that are available for your consideration. The first option is to maintain your current governance structure with a separate DSS board and a separate Board of Health. A note that under this option, the DSS board and Board of Health have the hire and fire authority for both of those directors. I would also bring to your remembrance that you do have active involvement in those recruitments by way of having board members from this board sitting on both of those boards, and then this board of commissioners has the final authority upon recommendation of hire. You approve the salary of both directors. Option 2 is for the DSS board and or the Board of Health to be taken, for this board to take control of those. And take control means to become the board, the DSS board, or to become the Board of Health. Under those options, you would be required to appoint a health advisory committee with a composition that mirrors your current composition of your Board of Health. Under that option, the Board of County Commissioners have the hire and fire authority directly of both directors. Okay, and you would have those directors reporting to your county manager, but you would have the hire and fire authority because you would be the board. The third option is to consider a consolidated human service agency and to appoint a consolidated human service agency board. Under that option, the county manager would have direct supervision of your consolidated director, and she would have hire and fire authority of that director with the advice and consent of that appointed consolidated board. And just by way of review, remember that's a board that statutorily has to be a minimum of 15 members, can be no more than 25 members. And the final option is to establish that consolidated human service agency and for this Board of Commissioners to serve as the consolidated board of that entity. Under that option, again, your county manager would have hire and fire authority with the consent, advice and consent of the Board of Commissioners as the consolidated board. So at this time, Mr. Chairman, management recommends that you consider selection of one of these options.
Okay, you've heard his presentation. You have 4 options. Commissioner Adams, I see your lights on.
Thank you, Mr. Chairman. Mr. Chairman, and Mr. Holder, I think this week you added a little wrinkle to that when you sent us that information from New Hanover, and I hope everybody saw that. That kind of gets me to where I was, which is that oversight piece. That was, when you sent it, I think I sent everybody back a note that would be where I would like to move toward, and that could be done in the option one with all of those, with some of the things that they had in place.
Well, right, in consideration, and we have been receiving information from various counties, and actually even following up even on what New Hanover, what the New Hanover model is. And what they resulted in was to have separate departments,
right,
but to try to achieve what they called functional collaboration between the departments and also between those departments and the county.
Right.
And so it's not unlike what the manager initiated last year in trying to push us in a direction of merging some functions, some like functions within the departments. But I would recommend that we, if we are considering that we do that when practical and feasible. There are some, we've gotten some feedback from, follow-up feedback from New Hanover that there have been some challenges with the way that they have organized. But we have already identified some functions for merger even internally. We're currently moving forward, for example, within our health department around the centralization of some IT functions, for example.
Well, they had those, but they also had some strong collaboration with the manager and the staff part. That was those understandings, those memorandums of understanding, and I think that was what I was getting to. I know the other part shows some efficiency in cost savings on the things, and that can be done, regardless. But I think those memorandums of understanding were what I was kind of looking at.
Right, and I think that was one of the recommendations that came out. Right. But upon checking with the state, there is no authority to actually establish those memorandums of understanding. So what I think they've settled on is what we're actually achieving internally now, which is a collaborative working relationship. It's been occurring since I came on board with each of those directors, and we've seen much closer working together both ways, both from the county to the departments and from the departments to the counties. The departments have been very engaged. Health department, obviously, with me being there, but also the DSS have been in regular contact. Ms. Jackson, for example, the manager has actually, if you look at our organizational chart, has assigned her as one of the general managers, so she's part of the management team. So even that change, for example, is moving us more toward a more collaborative model.
Commissioner Cass?
I hope that everyone has seen the letters written by both boards. Two of us sit on the, one on the health board and one on the social services board. I too am interested in strengthening the collaboration between the boards and county management. We have some ideas in theory, but maybe we need to solidify them by writing them so that they're actually serving in practice. But we need to go ahead and start a search committee. Well, not search committee, I don't know. Usually we use a search firm, I believe, for something this big. I think we need to go ahead and start searching, and I think that we need to rely on the makeup of the boards as they are now. We have some mandates from the state. We also have some positions that we are holding in abeyance. I would like for us, personally, we need to put a motion on the floor. And I move that we maintain the current governance structure with a separate Department of Social Services Board and Board of Health, and that we request management, the DSS director, the health director, interim health director, to look at some functions that where we can enhance services, perhaps save some funds and give more services to our clients. And I believe that we are entering the budget season now, but so that we can go ahead and start with hiring a director of the Board of Health. I move that we start this immediately, and that the manager and the 2 department heads prepare a list for us, and we, the manager, to give it to us and share it.
I'll second if you can repeat it.
Everybody here understood perfectly what I said.
Okay, we have a motion and a second. Commissioner Booth?
Well, I was hoping it wasn't gonna be just do nothing. So I'm not gonna be able to support that. I was hoping there'd be some give and take and some recognition of what we've already recognized. We've, as a group, met several times. We've recognized that there's issues. I don't even want to say that there are problems. I don't think we've identified any problems, but there are issues with the 2 departments in the overall results. And the definition of insanity is doing the same thing, the same way, again and again, and then expecting a different outcome. So it doesn't surprise me, and I thank them for their letter, and I read both of them, and I think I responded to both of them, that they wrote a letter that they don't want everything done. That's a natural response. But we met several times, we discussed issues, we thought enough of it that we had our staff, with everything else they have to do, investigate this, look into potential outcomes, other options. They drafted up a survey. 5 of the 7 of us responded to the survey. There's several national rankings, and several of us just got back from a national conference that Fayetteville was even in the brochure, I think, out of 186 out of 200 in quality of health life. That wasn't something that just happened in the last week or two. So it's upon us. And to just say, well, you know, it's the budget season, so we need to move on and hire somebody, that's not a comfort level for me that we've done anything. We haven't spoken outwardly about the issues. We haven't met about it. I don't know what functional collaboration is, so that doesn't make me feel better that we're going to have functional collaboration, because I don't know what it is. Words like cost savings, I understand, and that was in your letter about the New Hanover model. So the cost savings is a plus, but I think we're on a real slippery slope now, where we have publicly acknowledged, it's been in the newspaper several times about the issues that we've discussed and that we're looking into. And I think now to do nothing is like recognizing you have a loose brick on your front step, the mortar's not there, seeing it and then not doing anything about it. I think when that person slips, you're going to be paying a whole lot more than if you just fixed the brick. So just to do nothing is not satisfactory for me.
Commissioner Evans?
Thank you, Mr. Chair. Commissioner Booth, you're right. We can do something. I believe that we have heard from both sides, from both bodies, and I believe that as Commissioner Council does with her motion, I agree with that. But we can do something as far as these boards are concerned. I think that we as commissioners need to do better in selecting the members that sit on these boards that really have concern for those different departments. I think that that's something that we need to look at very seriously, because we need people that's going to be on the board, that's going to be on both boards, that are going to be genuinely concerned about the citizens of this county and the services that they receive.
Commissioner Keith?
Thank you, Mr. Chairman. I did read the New Hanover model, and I thought that was interesting, but Mr. Holder talked about various other counties. I can honestly say since the last meeting, I haven't gotten any more information on any other government models other than the New Hanover, and I haven't had any discussion with anything. But I'll tell you what I do know, that when the survey was done, there was 100% of the responding commissioners said that the health department governance model should be changed. That was 5 weeks ago. I just want to remind that over the past 2 years, we've had issues with jail health, breast cancer screenings. We've always, for decades, had problems with being number one in the state in STDs, heart disease, diabetes. We've also had a long history of being the bottom 25% in counties for decades in community health. And this is not the fault of the staff. This is a leadership problem. And that's a leadership from the high levels of the people on the board of the directors at the health department to their board of health, to our management staff, and ultimately right here on this dais. It is our responsibility. We are the 7 people elected to ensure that everyone is treated equally. It doesn't matter their age. It doesn't matter their social status, their income. It doesn't matter their gender, their race, or anything else. We treat everybody equally. So ultimately, the buck stops here. And as Ms. Baker, I don't know if she's still here, she indicated before that change has got to start here too. If we are content with taking a decades-old problem and just simply acting like it's not here, calling a meeting, bringing coffee and donuts, and thinking that everything's going to be okay, I think we're fooling ourselves. I supported the commissioners being involved because, as what was said earlier today, I think Commissioner Adams actually said it, government initiates change. And if you're content with the way our health department is going, then there is no change needed. But I think we can be better. Thank you.
Okay, Commissioner Council.
I agree with all of my colleagues. And I can remember having some discussions in closed session, diabolically in opposition, okay, to some of the comments that I'm hearing. I know that we have some issues in Cumberland County. We cannot solve them all overnight. I think we have educated ourselves. I also know that there are boards and commissions where commissioners have been assigned to attend, and they have resigned off the boards and not participated. So I want to have a group of interested, committed citizens appointed to these committees. And on that note, and that the management gives us, and the 2 department heads give us some suggestions so that we can strengthen services to citizens. And on that note, I can't call for the question because Mr. Fairclough has the comment.
Commissioner Fairclough.
Thank you both for recognizing me.
Sorry about that. I was picking cherries.
I understand. I understand. The reason I favor the motion, first of all, I think with commissioners assuming the duties of these boards, I think it waters down both boards because, you know, commissioners are pretty stretched out as it is, and I'm not sure we'll be. I think we could be effective for a while, but I'm not sure that that's the long-term way to go unless our renewed efforts going in the direction that Commissioner Council's taking us. Unless if that proves ineffective, then we still have this option. But I don't think that jumping right into having the county commissioners assume these duties is going to be effective after about the first 3 months. That's what I believe. And the other thing, and I have a question about this, has the state resolved whether or not they're going to consolidate social services boards across the state? And is there, does anybody have an update on that? I haven't heard anything different at this point.
That's not been resolved at this point.
It's not been resolved, so, which is what I thought, but I want to make sure I'm correct before I say anything. If we consolidate the health, excuse me, and social services boards now, we could have the state come along and unconsolidate them, and then turn around and consolidate the social services board with other counties. So it could be taken out of our purview anyway. And so one reason not to jump into it now would be to see what the state ultimately is going to do. We hope they don't touch us, but we don't know that. So for those two reasons, I favor the motion.
Okay, let's call for the question. I assume you were talking about option one?
Yes,
All right.
with
Would you restate
caveats.
your motion,
With the
please?
collaboration,
Maintaining the current governance structure with a separate Department of Social Services and Board of Health, and a collaborative effort model established by both the interim Director of Health and the DSS Director and our manager.
Okay. You heard the motion. Do I have a second?
Second.
Second.
I've really been doing other
I know, but I'm just trying to catch up, okay? Catch up. So we have a motion and a second.
I don't care who seconds it. I'll
All
second
those
it
in-
now.
All those in favor?
Voting in favor,
motion.
voting in favor, Commissioners Faircloth, Council Chairman Lancaster, Commissioner Adams and Evans. Voting in opposition, Commissioners Keith and Booth.
Okay. We're now at item B, under items of business, acceptance of funding award from North Carolina Department of Public Safety, Disaster Recovery Act 2017,
And-
hazard mitigation.
And although it's not on the title, it would include approval of budget revision 180484. Mr. Jackson, thank you.
All right. Good evening, Mr. Chairman and Commissioners. With me tonight is Gene Booth, our Emergency Management Coordinator, in case we have any questions as we go through this. He's here to assist us. We have for you an acceptance of funding award from North Carolina Department of Public Safety. This is the Disaster Recovery Act grant of 2017 for hazard mitigation activities. The amount of the award is $1,782,500, and the purpose is to mitigate 10 structures or residences that were severely affected by Hurricane Matthew. In December 2017, the county was asked to prioritize and submit a list of properties that were severely damaged and that residents who were displaced from the storm still had remaining unmet needs. So staff put together that list, submitted it to the state. This funding agreement will remain in effect for 2 years with reimbursement based upon monthly expenditure reporting, and the agreement may be extended by mutual written agreement of both parties. And staff recommends approval of the budget ordinance amendment B 180484 in the amount of $1,782,500 and acceptance of the grant award from North Carolina Department of Public Safety Disaster Recovery Act 2017 funding. Now, I do have some additional information for you, just for general knowledge. Again, this is for 10 residential properties that were damaged by the hurricane in the unincorporated area of Cumberland County, including small towns. Unlike previous HMGP dollars, these are state funds that can be used for structures outside the special flood hazard area outside the 100-year floodplain. We only had 2 structures in the previous round of federal funding for HMGP that met the requirements, and both of those were in floodplain. There was such a limited amount of money across the state previously in that program that many of the counties were not able to utilize funds or access funds for homes outside of the floodplain, which, as you recall, most of our damages were 2 structures outside of the floodplain. So this is a small start in trying to impact those damages and improve where we stand today in terms of the residents that need this aid. Again, it was prioritized based on the severity of damage, so it had to be at least 50% or greater in terms of the structural damage, and the families had to be displaced from their home and have unmet needs. So Mr. Booth and I are here to answer any questions that you may have. We'll try to do our best in that respect.
Commissioner Adams.
I just had one question. And I saw that the contract calls for like a reimbursement. You do it and you submit. Is that correct?
Yes, sir.
Okay, so, then I go down to the bottom, that either party may terminate this agreement upon 30 days written notice. What happens if it's terminated? Where's the money go? Who pays whatever's outstanding bills? I mean, there's nothing in here to that.
Right.
That last sentence just threw me. I mean, if the state comes and say we terminate this contract and we got $500,000 worth of billing, what happens?
I don't have an answer for that right now.
I didn't even know it was in there, Mr. Adams, so we'll
Yeah, if you look at the
Yes,
very
sir.
last sentence, I mean, the very last sentence says, either party may terminate this agreement upon 30 days written notice to the other party. It didn't go along with the rest of the termination, which is everything had to be mutual agreement. The terms of agreement is modified with mutual written consent, will remain in effect. It may be extended by mutual written agreement, but that last one says either party may terminate upon 30 days written notice. So I got $500,000 out there where we've expended or made contracts on, and the state says, here's your 30-day notice. Who pays that?
We can ask and get more information if that's what you desire.
I mean,
That needs to be done, yes, sir.
Well, I mean, I just want to know, I think there's an urgency to get this document back, but I think that in that last sentence, and I would have called you up earlier, it was my fault. I was just sitting here, and I didn't go all the way down to that termination clause till I just kind of went down and saw it. Otherwise, I would have tried to do that earlier, but that gives me some concern. I see Mr. Sprayberry's already signed it, I guess. And some other
I have a
parties.
question. Mr. Chair, to Commissioner Adams' point, aren't most of these acquisitions?
Yes.
Is there, then the sense of urgency, I mean, is probably not as great as a rebuild, but still, I'll leave it to you, it doesn't matter to me.
Well,
but-
I think they're, with all this going on in the legislature, I think we want to get this document back to Raleigh. Trust me on that. We want to get this document back to Raleigh, but I think we need to have some clarification on that 30-day. I think that needs to be on some kind of mutual consent or some kind of way that we end up ending this contract.
Okay.
So I would make a motion that we do it with between Mr. Jackson, Mr. Booth, and the county attorney, trying to at least modify that to make it a mutual agreement of some sort.
I'll second that.
Termination.
Second.
We have a motion and a second. Any further discussion? Not, call for your vote.
Unanimous.
Okay. Thank you.
I assume the vote you call for was
Yes.
Voting for it. Public hearings.
Show me the money.
Yeah.
Yes, sir.
Madam
Mr.
Manager?
Yes, sir. We have some uncontested rezoning cases. Mr. Lloyd.
Yes, ma'am. Good evening. The first case would be P08-07, and they're all uncontested cases. This is a mere rezoning from A1 to R40. Unanimous approval recommendation by the planning board, and no one was in opposition.
Okay.
Okay.
We will open the public hearing. Madam Clerk, do we have any speakers?
There are no speakers.
Okay, so we will close the public hearing, call for any questions or discussions. If not, motion. Commissioner Evans.
Thank you, Mr. Chair. In case of P18-07, I move to approve the rezoning from A1 agricultural to R40 residential and find this recommendation to be consistent with the Eastover Land Use Plan, which calls for 1 acre residential at this location, and further find approval of the request is reasonable and in the public interest because the district request is in harmony with surrounding lot sizes and land uses.
Okay, do I have a second?
Second.
We have a motion and a second. All those in favor?
Unanimous.
Okay.
Yes, sir. Case P1809 is a straight rezoning from A1 agricultural to R40. It's 4.2 acres. Unanimous recommendation for approval by the planning board, and no one appeared in opposition.
Okay, we will open the public hearing. Ask the clerk, do we have any speakers?
There are no speakers.
Okay, we will close the public hearing. We'll call for, we have a motion.
Mr. Chairman, in case P1809, I move to approve the rezoning from A1 agriculture to R40 residential and find, A, that the approval is an amendment to the current adopted Eastover Land Use Plan 2000 map, and that the Board of Commissioners should not require any additional request or application for amendment to said map for this request. B, the following change in condition was considered in amending the zoning ordinance, zoning map to meet the development needs of the community. The requested district is consistent with the draft Eastover Land Use Plan update, which calls for rural density residential development at this location. And C, this rezoning approval is reasonable and in the public interest because if approved, the district requested will ensure land uses and lot sizes are in harmony with the surrounding residential.
Okay,
Second.
have a motion and a second. All those in favor?
Unanimous.
Okay.
Yes, sir. P0812 is a rezoning of a little bit more than a third of an acre from C1P, planned commercial, local business, to C2P, planned services. It's located along Boone Trail. Planning board recommended unanimously for approval. There was no one that appeared in opposition.
Okay, we will open the public hearing. Madam Clerk, any
There
speakers?
are no speakers.
We'll close the public hearing. Mr. Booth.
Mr. Chairman, in case P18-12, I move to approve the rezoning from C1P, Planned Local Business District, to C2P, Planned Service and Retail District, and find A. The approval is an amendment to the adopted Southwest Cumberland Land Use Plan of the 2013 map, and that the Board of Commissioners should not require any additional request or application for amendment to said map for this request. B, the following change in conditions was considered in amending the zoning ordinance, the zoning map, to meet the development needs of the community. Although the district requested is considered light commercial, some permitted uses in the C2P are permitted uses in CP, which is considered heavy commercial. And C, this rezoning approval is reasonable and in the public interest because the district requested is in harmony with the area along Boone Trail that has been transitioning from residential to commercial and could assist in ensuring a vacant commercial building is occupied.
Okay,
Second.
we have a motion and a second. All those in favor?
Unanimous.
Mr. Lloyd.
Yes, sir. Case P1813 is a conditional zoning request from R5 residential and C3 heavy commercial to CP planned commercial conditional zoning for motor vehicle sales. This is, property is owned by the adjacent property owner for the motor vehicle sales. This would be just a display area. Planning board recommended approval unanimously, and no one appeared in opposition.
Okay, Madam Clerk, any speakers?
There are no speakers.
Okay, we'll open the public hearing. No speakers. We will close the public hearing. In case P1813, I move to approve the rezoning from R6 residential and C3 heavy commercial to CP planned commercial, CZ conditional zoning for motor vehicle sales, subject to the conditions within our packet, and find it is consistent with the adopted Southwest Cumberland Land Use Plan, which calls for mixed-use development at this location. Mixed use allows for retail and commercial uses. And further find that approval of the request is reasonable and in the public interest because the district requested is in harmony with the existing light and heavy commercial zoning and land use uses along Owen Drive. In addition, the property owner has agreed to access the vehicle display area from existing driveway for the sales lot and forego the proposed driveway to Cope Street. That's my motion.
Second.
I have a motion and a second. All those in favor?
Unanimous.
Okay.
P1814 is a rezoning of 10 acres from R5A to CP planned commercial, Middle River Loop, It's right off 301 going on to Middle Road before you hit River Road. Planning Board recommended approval unanimously. There was no opposition. And the draft Eastover plan is going to call for heavy commercial, already called for heavy commercial for this site anyway.
We will open the public hearing. Madam Clerk, any speakers?
There are no speakers.
We will close the public hearing. Commissioner Council.
In case P 1814, I move to approve the rezoning from R5A residential to CP Plan Commercial and find the approval is an amendment to the adopted current use Eastover Land Use Plan, the 2000 map, and that the Board of Commissioners should not require any additional request or application for amendment to said map for this request. And B, the following change in conditions was considered in amending the zoning ordinance or the zoning map to meet the development needs of the community. The requested district is consistent with the draft Eastover Land Use Plan update, which calls for heavy commercial development at this location. And C, this rezoning approval is reasonable and in the public interest because the district requested will allow for land uses that would be in harmony with surrounding commercial and industrial development.
Motion to approve.
That's my motion.
Second.
And a second. Okay, we have a motion and a second. All those in favor?
Unanimous.
Okay.
Yes, sir. Case P 1815 is a rezoning of 33 acres from RR Rural Residential to A1 Agricultural along Woodington Road. Although the Southwest Cumberland plan called for suburban residential, the property owners wanted to go back to agricultural. Planning Board recommended approval unanimously, and there was no opposition.
Okay. We will open the public hearing. Madam Clerk, any speakers?
There are no speakers.
We will close the public hearing.
Mr. Chair, in the case of P 18-15, I move to approve the rezoning from RR Rural Residential to A1 Agricultural and find that the approval is an amendment to the adopted Southwest Land Use Plan of 2013 map, and that the Board of Commissioners should not require any additional request or application for amendment to said map for this request. The following change in conditions was considered in amending the zoning ordinance and the zoning map to meet the development needs of the community. The subject property lacks public utilities to support suburban residential density, and this rezoning approval is reasonable and in the public interest because the district requested will provide for larger lot sizes than the current zoning.
Second.
Have a motion and a second. All those in favor?
Unanimous.
Yes, sir. P 1808 is rezoning of 1.93 acres from CP Plan Commercial and R10 Residential to CP. This is a result of back in 1998. What was advertised, the legal description did not match the map that was approved. There's a couple of slivers. There's really no change to anything other than to line up the lines with the legal description as it existed in 98. So the Planning Board recommended approval unanimously, and there was no opposition.
Okay, we will open the public hearing. Madam Clerk, any speakers?
There are no speakers.
We will close the public hearing. I believe this is case P 1803, which is now uncontested.
P 1808.
That was 08.
I'm sorry. P, well, I can't even see it myself.
Okay.
You got it
That's
pulled up?
Marshall.
Yes,
Marshall.
okay. Ms.
I
Marshall.
got one later on.
Yes.
I'll take it. Chairman, in case P 18-08, I move to approve the rezoning from R10 residential and CP Plan Commercial to CP Plan Commercial, and find A, the approval is an amendment to the current adopted Southwest Cumberland Land Use Plan 2013 map, and that the Board of Commissioners should not require any additional request or application for amendment to said map for this request. B, the following change in conditions was considered in amending the zoning ordinance or zoning map to meet the development needs of the community. The requested district is consistent with the majority of the parcels designation in the Southwest Cumberland Land Use Plan 2013, which calls for heavy commercial at this location. And C, this rezoning approval is reasonable and in the public interest because the small slivers of R10 residential zoning were inadvertently left out of the subject property's November 16, 1998 rezoning, and this request, if approved, will ensure the entire parcel is zoned the same.
Thank you, Commissioner.
Second.
We have a motion and a second. All those in favor?
Unanimous.
Yes, sir. Lastly, P 1803 is a conditional zoning of .93 acres from R10 residential to CP CZ conditional zoning for trade and outside storage. This is located along Gillespie Street and Elton Drive. There was opposition to the planning board, but the planning board did add another condition that there be no access onto the subject property from Elton Drive. It apparently satisfied the opposition. They also added a condition that all fluids that are drained be done over concrete and be taken off the site. With that, the planning board recommended approval unanimously, and there's no opposition here tonight.
Okay. We'll open the public hearing. Madam Clerk, any speakers?
There are no speakers.
We will close the public hearing. In motion, in case P 1803, I move to approve the rezoning of R10 residential to CP Plan Commercial CZ conditional zoning for trade, contracting with equipment storage, and other listed subjects to the condition within our packet, and find the recommendation to be consistent with the Southwest Cumberland Land Use Plan, which calls for heavy commercial at this location, and further find approval of the request is reasonable and in the public interest because the district requested is in harmony with surrounding zoning on parcels fronting Gillespie Street, which will allow for similar uses already permitted on the remaining parent tract. That's my motion.
Second.
Have a motion and a second.
I got a question.
Have a question.
I do have a question. You always got a question.
You're not gonna let us see American Idol, are you?
No, you ain't gonna see it, Mike. You
We got a
DVR
North
this.
Carolina, we got a
DVR.
North Carolina in the finalists.
My only question was, I heard you with the two things that satisfy, but who enforces those? If they don't do it on the concrete, then who enforces it? And what enforcement is there to be done? I mean, I can say I'm gonna do it once we rezone this.
Well, actually, really, the planning board asked for that on their own. The opposition was access and onto Elton Street. As far as enforcement, we'll see that the concrete pad there, it's, you know,
Or the other
we
part,
don't
if they
spot
don't
check.
go out the other way, who enforces that? I mean, if they decide to go out where they said we wouldn't go out, who enforces that?
Ultimately, we would with complaints. There's
And do
no,
what? I
there
mean,
would be
what's
no
the-
curb cut at least onto Elton Drive. If they want to go over the curb, then they would have to do that, but there'll be no curb cut onto Elton Drive. There will be a curb cut onto US 301. So
who does
we
that?
rely on the curb cut to enforce that, the access part.
So if I go out and cut the curb and go out that way, then what happens?
And we'll go out there and see, DOT will go out and ensure that, because they're in on this also with the curb cut. But you're right, unless somebody complains, if they do it after the fact, neither DOT nor we would catch it. We'll go out there for the overall CO, but they would, your question seems to be if they waited till after the CO, but quite frankly, that's, you know, with a lot of uses out there, because we're a response
Well, I mean, but you,
oriented.
and that may be true, but you negotiated this with these folks so they wouldn't be contested, and then we don't have any enforcement mechanism. That was all, I mean, that's up to,
Well,
I mean,
in
I
theory,
understand,
the
but, I
enforcement
mean,
is, in theory, the enforcement is DOT and the curb cut on that one. If they cut the curb afterwards, like anywhere else, they could get a curb cut and go do that, and then we would go back and issue fines.
Then they come fuss at us, the other people who thought they had an agreement.
Right.
Thank you, Mr. Chair.
Yeah, I have a quick question. This was originally a contested case and it became an uncontested case. Did it become uncontested because the people who were previously in opposition became satisfied with whatever the result was, or is it uncontested now because they didn't show up to contest?
Well, quite frankly, they were upset, the people that contested it, because, and the owners here, it wasn't the owner, it's who the owner was leasing the business to, was told by our department, you need to clean up the site before the planning board will hear it. They cleaned up the site, but moved some of the equipment onto Elton Drive. Okay, and that's when the residents across the street from Elton Drive were upset. We subsequently went out there and said, that's not what we meant. You get the equipment off Elton Drive also. He moved the equipment, They were more concerned that the equipment does not go back onto Elton Drive, that it stay contained and buffered on the site. And then it came up during the meeting that, hey, we just as soon not have any of the equipment access Elton Drive altogether. So they originally showed up because the lot was clean and some of the equipment was moved on to Elton Drive after they paid to have Elton Drive paved and have DOT take it over. That's initially how. So I think they're not here because they were satisfied that it's cleaned up, and they were, I would say, not to speak totally for them, they were happy to have that added condition of no access period onto Elton Drive.
Yeah, my reason for that is, you know, sometimes people don't know that they need to show up, so
Well,
I
one of
assume
them was
they're
a
notified.
longtime county fire marshal. I think he knew to show up tonight.
Ricky, I know Ricky, yeah. Thanks.
Have a motion?
You did the motion.
We've got the motion.
I made the motion. Do we have a second?
I second.
We got a second. Okay, all those in favor?
Unanimous?
Any opposed? Glenn was not sure.
I was slow, but I
He was
was.
slow. Okay.
I'll go with
Thank you,
that.
folks,
Thank you, Mr.
always.
Chairman.
Mr. Chairman, item number 5I is a public hearing on the 2018 draft Community Development Annual Action Plan. Our interim Community Development Director, Ms. Dee Taylor.
Okay, we will open the public hearing. We have any speakers?
There are no speakers.
Okay.
Oh, sorry.
Good evening, Chairman Lancaster and Commissioners. On behalf of the Community Development Department, I'd like to present to you our draft 2018 Annual Action Plan. This plan describes the activities, the projected projects, and funding sources that we plan to undertake during the upcoming program year, which begin July 1, 2018, and will go through June 30th of 2019. And by the way, this presentation just highlights the main points of the detailed action plan that you have in your packet. As you know, the county is designated as an entitlement jurisdiction by the U.S. Department of Housing and Urban Development, which basically means that we receive funding on an annual basis from HUD without having to apply for these funds through a competitive process. And we use the funds to support projects throughout the geographic service area, which include all of the 8 municipalities, including the unincorporated areas of Cumberland County. As a requirement, we are required to submit to HUD certain reports in order to continue receiving funding. These reports include the 5-year strategic plan, a consolidated plan, which identifies the needs of the community and the goals and objectives on how we plan to address those needs. The last consolidated plan that we prepared was in 2014, which covers the period from July 1 of 2015 through June 30th of 2020. Throughout that 5-year period, we have to also prepare an annual action plan for each year, which identifies the funding resources and the projects that we plan to undertake during that period. Through the consolidated planning process, we identified 3 major priority needs, and those needs include expanding affordable housing options in our community, addressing homelessness, and expanding non-housing community development activities, which include public services and public facilities. As an entitlement, we receive community development block grant funds to address projects and activities that must meet one of 3 national objectives, and that is either benefiting low to moderate income households in the community, or eliminating slum and blight, or addressing an urgent need. Another major funding source that we receive from HUD as an entitlement is the Home Investment Partnership Program, which is used to address housing-related activities benefiting low to moderate income households. And we do this either by providing direct services to households or partnering with nonprofit housing providers. The expected allocations that we will receive for the program year 2018 is $825,817 in CDBG funds, $399,148 in home funds, bringing a total of $1,224,965. In addition, we expect to receive an estimated $375,000 of program income, and this is income that we receive from loans that we make out to individuals or agencies. We also expect to receive approximately $1.1 million in carry forward funds, bringing a total of $2.7 million of allocations that we expect for the upcoming program year. We also expect to receive general funds of $124,242 to help support the admin and planning of the department. In addition, we expect to receive approximately $200,000 in an effort to support the homeless initiative joint effort between the city and the county. Of this, $56,007 will be used to fund the data and evaluation analyst position, and the purpose of that position is to manage the homeless management information system, or HMIS, that is required by HUD for local agencies to use in order to manage client-level data. In addition, $143,993 will be used to support direct services, which includes the HMIS fee and supportive services that will be managed by the selected nonprofit agency. During the consolidated planning process, we identified 4 major goals in order to address the priority needs. One of the goals is that we plan to increase affordable quality housing, and this will be done through our housing rehab project. This is the main project that addresses a major need in our community. This is for owner occupants and investor owners, where we plan to use approximately $368,731 of CDBG funds and $479,148 for home funds. In addition, we plan to use $159,872 of home funds towards new construction of affordable housing units. Project delivery will be $198,050 for that will be utilized from CDBG funds to pay for staff costs that are associated with carrying out activities directly. And $322,405 of CDBG and general funds will be used to support general administration and planning, as well as $59,915 of home funds. Our second major goal will be to expand essential services and housing for homeless activities. We plan to use $65,282 of CDBG funds, which will be used towards the required match of our of managing our transitional housing program, the Robbins Meadow Transitional Housing Program, and the Safe Homes for New Beginnings Permanent Supportive Housing Program. Both programs receive HUD funding, but we are required to match those dollars as well. And again, the general fund amount of $143,993 will be used to support the homeless initiative effort. Our third major goal is to improve access to public services. And this is where we plan to use $58,591 of CDBG funds to partner with selected nonprofits through a request for proposal process to support human services type activities. In the past, we funded agencies like Better Health of Cumberland County and Cumberland County Medication Access Program that will provide services that would benefit low to moderate income persons. And our fourth major goal is to improve public facilities and infrastructure, where we will be setting aside $100,000 of CDBG funds to support this activity. And this also is done through a request for proposal process. Other funding allocations we're expecting to receive in the upcoming year is the CDBG-DR, disaster recovery funds. For the first year, we're expecting approximately $3.7 million that will support housing recovery activities to include housing rehab, mobile home repair, and small rental repair type activities. In addition to multifamily rental housing, permanent supportive housing, and administration and planning. And our action plan timeline consists of community meetings with town municipalities. This was already done between November and January. We've had a public review comment period between April 3rd, from April 3rd through May 2nd, where we allowed the citizens to review the draft version of the annual action plan. The plan was distributed through several locations throughout the county, and we have received no comments as of today. And so today we're asking the commissioners to hold a public hearing to allow for citizen input. After today, we will submit the final action plan for board approval on June 4th, and from there submit it to HUD for final approval within 60 days after notification of our allocations. And at this point, do we have any questions?
Commissioner Adams and Commissioner Keith.
And I just got one
Sure,
question. If you could go back to, I think, the very first one that we had, the first objective. Was it the first one?
First
Keep
goal.
going one more.
This one?
This one, yes.
Uh-huh.
And we've got housing rehabilitation, and we're gonna spend almost, no, go back to the first
I'm
one.
sorry.
Almost $847,000 on rehab.
Well, this
And then we're just gonna do about less than 160 on some affordable housing. And then you went to the very last slide with the the recovery funds, and we're gonna rehab some more. So we're gonna have well over $1 million and some in rehab, and not a whole lot on affordable housing. And I just heard the pathways to prosperity talk about, and some of that's in the city. There was some incorporated areas and out there, and this is all about funding and meeting the guidelines. But I think when we put this much in the housing rehabilitation and not looking at this affordable housing key, and you take that and I turn around and deal with these individuals that's coming out of jail and the crisis who have no housing. That those numbers, how do we get to the rehab as opposed to the affordable housing? I think if we can do some affordable housing to house some of these folk are much better than, and I don't know how many houses we're gonna do. That's a lot of houses. I can't even break that down. Mr. Keith got the numbers for me. He'll break that down, how many houses on the rehab, what that comes to per house.
And I understand, and I agree with you. However, over the years, our funding has decreased, and therefore the amount of funding that's available to develop affordable housing, most of the time, developers in the past approached us for funding when we had larger pots of money. But recently, when I did when I prepared a request for proposal for the development of affordable housing, I did not receive any interest because the funding pot is
Well,
so
that's what I'm saying.
small.
If we take it out of the rehab and put it into the affordable housing, don't we have a bigger pot of money that I, as a developer, may want to do? I mean, if you only talk about 160, heck, I don't know many developers who gonna come down and do stuff for 160,000. It just,
Right,
I mean, that's
right.
not, but I've got 800 and some thousand plus whatever you're gonna do in the recovery funds in rehab. Couldn't I take some out of the rehab to move it down to the affordable housing to impact that greater, and then I may be able to get the developers? I guess it's the chicken and the egg, is what I'm looking at.
No, and that's true. We could do that in hopes that we still get some interest. Again, we just haven't received much.
Right.
With that amount.
So let me ask this last question, and,
Sure.
and then I'll go to Mr. Key. If we do this, can it be moved, the money? Once
Yes,
it goes
we
to
can.
HUD? So
Yes, we can.
we're not locked in to 847. This is just what you're setting up as a proposal.
Correct,
HUD's
based
gonna
on the,
approve it.
yes.
But if it comes down and we say, hey, we want to do more in the affordable housing, we can take some of that money and move it into the affordable housing?
We'll
Or do
have
we
to
have to get a
we'll
waiver?
have to just get we have to revise our plan and just submit it for
So we need to do
approval.
it in advance?
Yes,
In terms of moving money, if we're gonna move money? And I'm not gonna hold your plan up
Sure,
for this,
no,
because I
that's
know you
fine.
gotta go.
Well, I'll take into
to-
consideration of
to-
that.
To get to DC, because we don't want to lose those funds.
Mhm.
But I think we ought to at least look at trying to move some of this money into some affordable housing. I'm
Okay.
dealing with some crisis issues.
Mhm.
That's the new thing. I just got a proposal that the county do $500,000 for some crisis unit that Madam Manager didn't even know about. I told Mr. Holder about it, but, and so those are some of the things I think we can use some of this money for that specific need maybe.
I agree.
we can
Yes,
kinda
sir.
move that
Yes, sir.
around a bit.
Yes, sir.
Thank you,
Mr. Keith.
Thank you, Mr. Chair. I actually have a little bit of a different opinion, surprisingly, than Commissioner Adams.
No way.
I know, as the calm comes over the audience here. But, I mean, when I look at affordable housing, I'm not surprised the number is that low because we're only dealing with the unincorporated areas, correct?
That's
And
true, you're
affordable
right.
housing, isn't it normally built in areas that have service areas, which to me would seem like, I don't think affordable housing would be as effective out in Wade or Beaver Dam or some of the other places without a lot of core services. Is that sort of the rationale behind the number being lower? Because you're not really building affordable housing in unincorporated areas that aren't near service areas.
Well, part of the reason in the past, developers in the past, when they approached us for funding, is to help leverage their entire project cost. In the past, they approached us with requests for 600 or so thousand
I would hope we're
dollars.
not, I'm sorry, Dee. I would hope we're not letting developers decide where affordable housing should go.
No, sir, it's just that the type of project, multifamily rental housing development, for instance, in the past, would require more funding than, like I said, than we're able to provide. And so over the years, again, we just haven't received much interest from those type of developers that have big plans, I guess,
Yeah.
than what we can
No, I
help
understand
support.
the rehabilitation, you know, the people
Mhm.
that have low, but if you're looking for homeless units or in some levels, some levels of affordable housing,
Mhm.
I would think that part of your plan would be that they are in close proximity to some sort of services. It
Oh,
doesn't
yeah,
do
right,
any good to put
absolutely,
a
right.
homeless unit where there's no services. They're homeless. They don't have transportation. They don't. So,
Mhm.
anyway, how has the disaster recovery, community development block grant money, how has it moved the needle? Because by my calculations, we're somewhere around $10 to $13 million between affordable housing and homeless units.
Mhm.
How has that moved the needle here? It doesn't seem like you're getting a big piece of that with the $3 million.
Well, that's just the year one allocations
Okay.
out of the total 23
Okay, is your
million.
group gonna be doing the whole 13 or million or whatever our, Tracy, our? About 37 between the city and county. So what's our portion? 23. So
Mhm.
ultimately, is 23, is it gonna be up to your department to, that whole 23 and this 3 million is just a piece of it?
That's our portion for year one.
Yeah.
The entire county portion is about 8 million for the 2-year period. I was just including year one
Okay.
for.
You're not gonna be doing the other 5 million?
Yes, sir. But for this purpose, I was just including
Okay.
that portion for the year one,
Okay.
for the period of July 1, 2018.
So has it changed the needle? Has it moved the needle at all about providing more affordable housing and homeless units?
Well, we do have that amount of, let me just go back to it here.
Well, I saw that it was 3 million.
Yes, the 3.7 million, that's just year one allocations.
Okay.
Of that amount, and that's the county portion. And we are partnering again with the city. Out of the total 23 million, 15 million is going to the city, and we're receiving 8 million of that. Well, you're referring to the 35 million. Well, the state is allocating only 23 million for the first 2 years, and then based on our performance, we'll provide the additional funding. But based on our performance after the 2-year period.
Okay, I have 2 other things, and I'll make them
Sure.
quick. You know, you had a slide here about your carryover funds. I was wondering why that number was, towards the beginning. The carryover funds were almost the exact same as the allotted funds for this year. Was there a reason why the carryover funds were so great from last year?
This is based on the average amount of funds that we have either from pending projects that are carried over from the prior year. Sometimes we're not able to close all our projects.
They're in
Right,
process.
right. Mhm.
Okay. And the last thing is you mentioned blighted areas. I had asked this question before, and as of a couple years ago, there were no designated slum or blighted areas in the unincorporated areas. Are there now?
Not to my knowledge. At least none have been presented to me.
Okay, but we still put that down as a priority?
If it comes up as a need, yes.
Okay. All right, thank you, Dee.
All right, thank you.
Any other questions?
Okay, thank you very much.
About a motion to approve the plan? No motion. Okay, thank you, Dee. I guess
to receive it. You want a motion to
we're
approve?
gonna close the public hearing,
Set a public hearing.
and at this time, I guess we've gone through our questions and discussion, so we're good to go? All right.
Yes.
We're now down to public hearing in order of, we're gonna close a portion of the finish line.
We'll bring it back June 4th, and that's when we'll take a vote.
Yeah. Okay. Mr. Moorfield.
Thank you, Mr. Chairman. Board members, back on April 3rd, you adopted a resolution of your intent to close a portion of a public road, Finish Line Drive in Rockfish Township, based on a petition filed by James and Anita Hilton. They were the owners of all the property surrounding this dead-end stub of Finish Line. And it was presented for that, for your consideration that time, notice from DOT that it was not state-maintained, and anything else that was needed for you to make the findings to adopt that. The proposed order is an attachment to this in your package, which the exhibits that are identified there are also attachments. One is the order confirmation from the Fayetteville Observer for the advertisement of this public hearing and resolution of intent on May 4th, 11th, and 18th. We had not received back the publisher's affidavit in order time to get it for the agenda on this, but we did attach the order confirmation. There's an affidavit from one of the petitioners posting this notice at 2 prominent places on the portion of the road to be closed. That is a statutory requirement. And then the legal description prepared by the surveyor that did the plat for the petitioners is attached as Exhibit C. If you have to hold a public hearing, and the notice is provided in accordance with the statute for anyone for the public hearing. And if you wish to finalize this and adopt this order, it will be signed by the chairman and recorded in the Register of Deeds. Need to open the public hearing,
Okay.
Mr. Chairman.
Open the public hearing at this time. Madam Clerk, any speakers?
There are no speakers.
Okay, we close the public hearing. Any questions, discussion? Commissioner Booth?
Move we approve the order to close a portion of Finish Line Drive as presented by the attorney.
Okay.
Second.
Motion is second. All those in favor? That's
Unanimous.
Number 6, nominations. Commissioner Council.
I thought you had me for appointments. I'd like to nominate for the position that is coming vacant because of a resignation. I'd like to nominate Mr. Wade Harden. And I'd like to nominate, I got another one. I forgot his name. Lee Botman.
Okay. Any other nominations? Commissioner Booth?
Yeah, I'd like to nominate Paul Crenshaw.
Okay. Paul Crenshaw.
For which one?
For which one?
It's the one, the Harden one?
For the one that Kenneth Edge is vacating.
Okay.
And which one did you nominate for that?
Does it really matter?
One's a full spot, one's just a part spot.
No,
2 years.
he's coming up though, right?
Who?
Wade
I
Hart.
don't think.
He's at
Wade
the end of
Harden's
his term.
coming up now,
Yeah.
but Kenneth Edge wasn't. I mean, his is he resigned.
Well, I think the intent of the letter was they needed Wade for the chair or wanted him for a full year, not just the next month or two. And so if it matters, I would nominate Crenshaw for the Kenneth Edge vacancy.
Hold on, I'm lost.
I have a question about
Okay.
that.
Commissioner Fairclough?
Will whoever gets that slot take over immediately and then be eligible for a full? Okay. So it'll just be
What?
for just
2
a
years.
month? It'll be just for a month and then, or what?
Did I
What-
do it
when-
wrong?
When, I don't know, when
It-
was Edge's,
If you're
term
filling,
up?
Mr. Fairclough, if you're filling a vacancy, it would be for the term remaining in the vacancy.
How much is remaining?
I don't.
Anybody know?
2 years.
About 2 years.
About 2 years, okay.
2 years, which would make it even, instead of the 1 year that was requested.
Gotcha.
It would,
So those two
Make it-
nominations are for that slot, am I right about
No.
that? No?
oh, I don't know. Mine is for that slot, the Kenneth Edge slot, Mr. Wade Harden.
Okay, that's where you put yours. You put Crenshaw in that one.
And Lee Botman is for the term that would be starting, that Mr. Harden would be starting on, would be leaving
Okay.
for a full 3-year term. for a full three-year term.
In the Kenneth A. spot.
Yes, it's for unexpired.
Do we have to, is that? Do what?
Four?
I don't know, but this was,
So what do you want?
Is that? Well, see, Charles is the one that said he was gonna do it, so I don't know what he had planned.
I'm nominating those two. Is there
Is that where he is now?
still clarity needed?
Yeah.
You nominated two, he's nominated one, so it's
He's
Yeah, he put
nominating-
one, he put his in Wade Harden's spot, the one that Wade,
Oh.
and he nominated Crenshaw.
Oh, okay.
All right.
I don't know where you
So we
plan on
have
doing it, so they're saying that there's one that has a year off because of Kenneth's been on it a year, and there's about 2 years left on that one. He's
Right.
resigned. And then Wade's term is ending, and so that's a new full one, so I don't know where you intended it.
Yeah, that's what we, in Kenneth's spot.
Yeah.
Okay.
Yeah, Kenneth's spot.
Yeah.
So you got
Wade
Wade
Harden.
and Harden and Crenshaw, and then you got
And then you got who else?
Lebo.
Oh.
And Lee Botman to do the full term. The ABC board right now is in the process of doing long-range planning. They have a lot of business. I've got Mr. Horn, who is here. I am amazed at the business that they do and the funds that they contribute to the different causes. So to have a continuity, since we are engaged in long-range planning, I nominated Mr. Harden so that he could complete that. And I nominated him for 2 years so that we wouldn't throw the process off by just extending him for a year.
Thanks. All right,
Okay?
all right.
And Lee Botman for the full term.
Are we ready for appointments?
Okay, you ready for appointments?
Joint Appearance Commission.
For the Joint Appearance Committee, Mr. Chairman, I move that we appoint Christopher Davis and Latara Ray to the Joint Appearance Commission.
Second.
We have a motion and a second. Any other nominations or appointments? If not, a call for your vote. All
Is
those
it
in
two
favor?
people, two vacancies?
Yep.
Unanimous.
There's some states they normally do on that, there being two nominees and.
At this time, we're going to recess the Board of Commissioners meeting. I hereby recess the meeting of the Cumberland County Board of Commissioners. We're going to convene the Overhills Park Water and Sewer District Governing Board meeting. So I hereby convene the meeting of Overhills Park Water and Sewer District Governing Board. The meeting of the Overhills Park Water and Sewer District Governing Board to order. And we are at their consent agenda.
I will move approval of the consent agenda.
All right.
Second.
We have a motion to approve and a second. All those in favor?
Unanimous.
Okay. There is a resolution authorizing the issuance and sale of water and sewer system revenue bonds, Series 2018 of the Overhills Park and Water and Sewer District in the aggregate principal amount of $1,379,000. Manager Cannon.
Yes, sir. Mr. Chairman, I'd like to ask our Finance Director, Ms. Vicki Evans, to come forward and to explain the resolution, please.
Good evening, Mr. Chairman and Commissioners. The resolution was provided in the packet, and to summarize, the project is scheduled to close on June 11, 2018. 2 separate bonds will be issued. The R1 bond amount totals $819,000 and will bear interest at a rate of 2.375% per annum. The R2 bond amount equals $560,000 and will bear interest at a rate of 1.625% per annum. The bonds have an aggregate principal total of $1,379,000. This resolution also authorizes the county manager, county finance officer, clerk to the board, and other officers of the county to execute and deliver documents related to carrying out the resolution, the 2018 bonds, and the payment of the note. The recommended action is for the board to approve the resolution entitled Resolution Authorizing the Issuance and Sale of Water and Sewer System Revenue Bonds, Series 2018 of the Overhills Park Water and Sewer District in the aggregate principal amount of $1,379,000.
Thank you. Any questions, any discussion? If not, call for a motion.
Mr. Chairman, I would move to approve the attached resolution entitled Resolution Authorizing the Issuance and Sale of Water and Sewer System Revenue Bond Series 2018 of the Overhill Park Water and Sewer District in the aggregate principal amount of $1,379,000.
Have a motion and a second?
Second.
Have a motion and a second. All those in favor?
Unanimous.
Thank you.
We will adjourn the Overhills Water and Sewer District Governing Board meeting. I hereby adjourn the meeting of the Overhills Governing Board, and now we're going to convene the Norcrest Water and Sewer District Governing Board at this point in time. We will call for the meeting of Norcrest Water and Sewerage District Governing Board to order. And how about that, Madam Manager?
Yes, sir. Item 10A for the Norcrest Water and Sewer consent agenda is approval of amendments to the Norcrest Water and Sewer district rate structure. This item was presented at the May Finance Committee and was approved and moved forward to the Norcrest Governing Board agenda for your consideration this evening.
Okay.
Okay. Oh, he's got it. Go ahead.
Mr. Chairman, I would move approval of the consent agenda item which came out of the finance to approve the rate structure amendments for the Northwest Water and Sewer District edit, which we did at the May 3rd, 2018 meeting.
We have a motion.
Second.
And a second. All those in favor?
Unanimous.
We will now adjourn the meeting of the Norcrest Water and Sewer District Governing Board, and we will reconvene the regular Board of Commissioners meeting. So I state that we are reconvening the meeting of the Cumberland County Board of Commissioners. I see our young ladies probably had to go home with their homework. God bless them. At this time, I'd entertain a motion to go into closed session.
Mr. Chairman,
Yes.
I move that
Commissioner
we go into closed session for 3 attorney-client matters pursuant to General Statute 143.318.11A3, and for an economic development matter pursuant to North Carolina General Statute 143.318.11A4.
Okay, we have a motion.
Second.
Have a second. All those in favor?
Unanimous.
Okay. We're now in closed session.
You want this back?
Okay, how about a motion to come out of closed session?
So moved.
Okay. There's a motion and a second. All those in favor to come out of closed session? Okay. We move to adjourn. Second.
All in favor, stand up.
Stand up.
Oh.